COVID-19 and our local response effort. Joining me again is interpreter Margie Prop, and thank you so much to Margie for providing your services. And thank you to the media and to all our residents who are tuning in to find out more about how you can protect yourself, your loved ones, and our community. We want to remind everyone to please visit our website, covid19.lincoln.ne.gov, where you can continue to access additional updates and resources to help navigate these times. The website includes a data dashboard that is updated once a day about the time of this briefing, and you can learn more about the health department's cases investigations at that dashboard. The website also features our COVID-19 risk dial, a simple tool designed to help everyone know what actions and behaviors we can take to protect our health and that of others. The COVID Risk Dial provides a visual, color-coded depiction of local conditions we're experiencing here in Lincoln and Lancaster County. And in other words, it basically provides a forecast of risk. And because the risk of spread of COVID-19 in our community continues to be high, the dial remains at orange and comes with the following recommendations to help keep everyone safe. Stay home as much as possible, and definitely stay home if you are sick. Keep 6 feet of distance between yourself and others. For those over the age of 2, wear a face covering when outside the home, and continue to wash your hands frequently with soap and water, and routinely disinfect highly touched surfaces. Later in this briefing, we'll be discussing a new feature of the COVID Risk Dial that is designed to provide guidance and recommendations for businesses. In the meantime, we'll share with you today's numbers. Here in Lincoln today, we have had an additional 8 individuals test positive for COVID-19. The total number of lab-confirmed cases in Lincoln now stands at 918. Our total recoveries identified to date are 131 individuals. And just as a reminder, an individual is deemed to have been recovered from the virus 28 days after they tested positive for COVID-19 and have been confirmed to be symptom-free. Interim Health Director Pat Lopez is now here to provide an update and more details on the Health Department's investigations of today's cases.
Thank you, Mayor. We have seen an increase in testing in Lancaster County for the past 4 consecutive weeks. Last week alone, over 3,000 tests were completed, and since Sunday, we have already had over 2,000 tests completed. In addition, the addition of Test Nebraska has been part of that increase. Test Nebraska began testing in Lincoln at the Lancaster Event Center on Friday, May 8th, and will be here at Lancaster Event Center through the end of May. All samples taken at Test Nebraska sites are being sent to CHI Health, St. Elizabeth in Lincoln for results. For more information, you can visit testnebraska.com to complete a risk assessment and be scheduled for a test. Yesterday was a slower day with Bryan Health and CHI St. Elizabeth reporting just 240 tests completed at the hospitals and the drive-through testing sites. Again, these sites have the ability to do 300 to 500 tests per day, so on many days they have the capacity to do more. If you have symptoms of COVID-19, we urge you to get tested now. To get started, you can fill out a risk assessment at chihealth.com or bryanhealth.com or testnebraska.com. The number of local hospitalizations of COVID-19 patients is down from 42 yesterday to 37 today. That includes 20 from Lancaster County and 17 from other parts of the state. The number of patients on ventilators is now 12, which includes 6 from Lancaster County and 6 from other parts of the state. Our Lancaster County positivity rate is down slightly from 8.5% yesterday to 8.2% today. The state rate has dropped from 15.2% yesterday to 15% today, and our national rate remains at 15.7%. Today we have no new Lancaster County cases that are connected to the outbreak at the Smithfield plant in Crete. We have also not seen any new cases connected to the Smithfield plant in Lincoln or the Smart Chicken plant in Waverly. We will continue to share information on locations like this as data becomes available. As we move forward and continue to consider how things will look in the coming weeks and months, The Health Department has developed a public health guidance tool to help the public better understand our local situation. As the mayor mentioned, the COVID risk dial is intended to provide a context for where the city of Lincoln is at in the COVID-19 pandemic. It is a tool to help the public know what actions and behaviors they can take to protect their own health and the health of everyone in our community. We have continued to build on this tool and expand how it can be utilized. Today, we will talk about how the risk dial can be applied to businesses for incorporating specific strategies to reduce the risk of spread of COVID-19 in the workplace, with an eye towards protecting employees, customers, and our community. Most businesses that are currently operating have already implemented safeguards to protect employees and customers, such as temperature checks of employees, limiting occupancy of physical spaces, structuring workflow to minimize commingling and close interaction, having hand sanitizer available at entrances, routinely disinfecting highly touched surfaces, and creating expectations that employees and the public will wear cloth face coverings around other people. I want to again thank the business community for continuing to be supportive during these unique circumstances and for the patience they have shown. But most of all, I want to thank businesses for their receptiveness to new guidance and their proactiveness in implementing preventative strategies. It is clearly understood that the loosening of restrictions is being done in a way that protects the health and safety of our workforce and the public.
Thank you, Director Lopez. And as Director Lopez shared, today we turn to the topic of safe business operations. And at the outset of this public health emergency, we said that the people of Lincoln ultimately will be the solution to this crisis. If there's anything that the virus has demonstrated, it is that we are connected in more ways than we can imagine. And the seemingly small actions of one person, for good or for ill, can reverberate in large measure throughout the community. This is especially true for businesses and the many customers, employees, and individuals that comprise them. In view of the importance of safe business operations to our community's public health and economic recovery, we're pleased to announce a new COVID risk dial that is tailored to businesses. This new dial will help businesses navigate the pandemic by providing guidance on how to operate more safely in light of local health conditions. Here to explain more about this new feature is Scott Holmes, Division Manager of Environmental Public Health with the Health Department.
Thank you, Mayor. First, I would like to once again thank our team from the Health and Fire Departments and City Communications that developed the COVID risk dial and built it out to help apply to businesses and industries. We use several national resources on reopening businesses, including Johns Hopkins University, the Federal Plan for Reopening America, and the U.S. Centers for Disease Control business guidance documents. Closer to home, we relied upon information developed by the Nebraska Grocery Industry Association, which readily applied to many retail businesses. We worked with local industries like Kawasaki, who's here today, who asked the Health Department to review their operation protocol for reopening production and operations at their business. In addition, we also looked at good business practices that we've observed, such as at QP Ace Hardware. Health Department staff interacted with hundreds of businesses over the past 2 months about strategies to reduce the spread of COVID-19. Utilizing all this information and input, we developed a comprehensive strategy that can be easily used by small and large businesses of all kinds, ranging from our largest manufacturers to small retail shops. This comprehensive strategy provides guidance in 4 areas: physical distancing, engineering controls, administrative controls, and personal protective equipment, or PPE. Physical distancing is limiting close, prolonged contact with others. Businesses can review their own operations and determine how they will ensure both employees and customers can be separated in distance to protect them from COVID-19. Engineering controls means creating physical barriers installing equipment and using technology to reduce the frequency and intensity of close contact between people. For example, this can include rigid sheets of clear plastic to protect cashiers and customers we have all seen in retail and grocery stores. Another example is using no-touch technology for credit card systems. Administrative controls can include in-house training and implementing procedures that reduce transmission of COVID-19. Examples for businesses could include requiring all employees to wear face coverings, staggering shift times so that employees do not interact as much during the shift change, or training staff in effective hand washing and disinfecting high-touch surfaces. PPE is protective clothing or equipment that can reduce the spread of COVID-19, such as cloth face coverings or gloves. So let's go to the city website, COVID-19 response page, and click on the Business Resources tab. It reveals that the COVID risk dial is there and the link to the business guidance and recommendations. As already mentioned by the mayor and Pat, the COVID risk dial provides information on where we're at currently in our community. Right now, we are at the orange level. Clicking on the Business Guidance and Recommendations tabs brings up 4 buttons. On the left is the Overview tab, which, not surprisingly, provides you an overview of the business guidance. Clicking on the General Guidance and Recommendations tab brings up 4 buttons. The website loads recommendations for our current risk of COVID spread. As you can see, the physical distancing includes guidance of keeping workers at least 6 feet apart. As you scroll down, you will find recommendations for engineering controls, like installing physical barriers between workers, administrative controls, such as screening employees for illness, and PPE, like face coverings. At the bottom of this section, there are 2 valuable links. The first takes you to a PDF of the business recommendations, and the second goes to frequently asked questions, which is built from a CDC model. The next tab is titled Workplace Specific. This tab includes 3 buttons which will allow anyone to download the general guidance template documents as an Excel or Word file or as a PDF. Let me repeat that. These are downloadable files that any business can use in the community. These will serve as a great resource for our local businesses to create their own specific plans. Other workplace documents available include the guidance documents for dine-in restaurants, childcare facilities, farmers markets, etc. One other thing I'd like to highlight is the At-Risk and Vulnerable tab. Under this tab, clear guidance is provided to employers on how to protect their employees who are at high risk for severe illness from COVID-19. We hope the COVID risk dial will be useful to not only the general public, but also to our local businesses. Finally, I'd like to say thank you to our businesses for their efforts to protect their employees, their customers, and our community, and for their perseverance through this difficult time. Back to you, Mayor.
Thank you, Scott, and thank you so much for all of your efforts, for the efforts of the health team, the fire department, and our city communications team to supplement our COVID-19 risk dial with this new set of business guidance that we hope will be of great use to our community. And at this time, I would like to introduce 2 business leaders to discuss the strategies that their businesses are utilizing to operate safely. And these businesses have taken their responsibility as employers very seriously and have adopted sound physical distancing practices, engineering controls, administrative controls, and PPE practices in order to protect customers, employees, and the public. These businesses are committed to being part of the solution, and we are grateful for their conscientious leadership. With that, I am pleased to be joined by Jason Helbush, who is the Director of Administration at Kawasaki Motors. He'll discuss Kawasaki's public health measures in the industrial operating space. Jason, over to you.
Thank you, Mayor. As many of you know, Kawasaki had shut down our operations during the month of April as the pandemic was increasing and The number of cases was growing. We knew we didn't have enough of the safety measures in place that would protect our employees. So we made the conscious effort at that time to shut down operations and prepare for what the new future looked like. At that time, we had our safety team reach out to Scott and his team with the Lincoln Lancaster County Health Department and work out what would be best for a business of our size and how to operate. So during the shutdown period for our business, we were busy working on these plans, and we were doing stuff behind the scenes that would help for the reopen of our production facility. So at that time, we did a deep cleaning and disinfected the entire facility. We did some of the controls that were mentioned earlier, such as changing our time clocks over to a touchless version. We rearranged our cafeteria to allow seating that was adequate in the social distancing aspect. So we reduced the number of chairs available to keep people 6 foot apart. We did things like get rid of the salad bar so that people would not be on or around other people's food. So all the food went to prepackaged at that time. Also installed visual controls. We used a lot of markings on the floor, X's to illustrate to people where they should stand and how far 6 foot actually is. So as we got through that phase, we went into the next phase of bringing people back. By the start of May, we had brought back almost all of our employees. And at that time, we've required everyone to wear a mask at all times in the facility. So we feel that is one of the most important aspects that we can do because with approximately 2,400 people on site, at times it's hard to maintain 6 foot. People forget. So if they have a mask on, it increases their protection. We're promoting frequent hand washing. We've eliminated all unnecessary business travel. We continue to monitor people's temperatures daily and increase the daily cleaning and disinfecting efforts within the facility. So those are big efforts. We've also switched some of our office protocol away from large meetings. We're trying to utilize applications such as Zoom and WebEx whenever possible. And basically, whatever we do, we want to keep communicating with our employees. We know that's important. We want them to understand what we're doing. We want them to feel safe. So over-communication is better than not communicating. So because of the efforts of our staff at Kawasaki and the health department, we feel that right now we've really minimized the impact of the coronavirus on our facility. We'll continue to fight the virus and use all the best practices that are published, whether it be through the local government sites, the health department, or the CDC. One of the biggest things we want to enforce and communicate with our people is if you don't feel well, stay home. That's the biggest thing. We don't want people that are not feeling well to come into the building. So that's probably our number one line of defense. But if and when cases do occur, we will work closely with the health department and the contact tracers that they provide and try to limit the exposure to everyone as much as possible. So with that, I want to say that we appreciate the leadership of the mayor through this pandemic. We know it's been kind of an unprecedented situation for us, and we're all learning. And the Lincoln Lancaster County Health Department has been a big help as well with helping us develop this plan. I also want to thank our employees. Our employees have been great. They have taken this very seriously. They've been taking good care of themselves. They've been taking good care of their families and their friends, and that's keeping the impact low for us, and we're very much appreciative of that for our people. So we're happy to be back at work building products that people enjoy using from Kawasaki, and we hope to continue that for the long run now. So thank you.
Thank you so much, Jason. Kawasaki has just been an exemplar among our industrial business operators and manufacturers in terms of your commitment to public health, and we're grateful. We're also grateful for Kawasaki's extensive efforts to limit the spread of COVID-19 and for their close collaboration with our health department. It has meant so much. And we're also joined today by Trevor Beauchart. He is the sales manager of the QP Ace Hardware store on South 27th Street. And Trevor will discuss some of the measures that his store has implemented in order to protect public health. And with that, I hand it over to you, Trevor. Oh, zooming in.
Good afternoon, and thank you for including us. Since the beginning, we've tried to take a very proactive instead of a reactive approach to the situation. We've had guidance from federal, state, and local health agencies. We started with a very clear message to our associates. Any of our employees that were at risk, that felt uncomfortable, or had children to take care of at home were guaranteed a job back when they felt it was safe to come back. We've set up a sanitizing schedule at all of our locations. We're cleaning everything from counters to carts, phones, registers, handrails, those commonly used areas. We clearly marked areas in our checkout sections so that customers can see that 6-foot distance that we're trying to promote. We have the plexiglass shields up at our registers, keeping the distance between our cashiers and customers that are up there. We've also put our receipt printers on the other side of the glass so that customers can directly grab their receipt, just reducing the amount of people coming in contact with the same items. We've designed t-shirts for our associates to wear that help promote our dedication to social distancing. Again, showing that 6 foot that we appreciate everyone taking when they come in. Other aspects of our business that have changed are our online orders, our deliveries, and our curbside pickups. All of these have helped to reduce the amount of physical contact between customers and our associates here in the store. We have also added the capability of completing customer purchases for products that are located outside of the store with a mobile point of sale during the busier times of the week. We've helped overcrowding in the store by limiting 20 people in the store at a time. It just helps keep people from crowding in the same aisles and up at the registers. We have been very transparent with our customers and our employees during these policy changes with the increased effort of cleanliness and safety through signage throughout all of our stores and constant communication. We've provided to our associates masks, hand sanitizer, disinfectants, face shields, gloves, and we've had that constant and consistent communication about good hygiene and hand washing. From an administrative perspective, we've had to adjust our scheduling. We do have reduced hours with our reduced staff, but this has also created an opportunity for those associates not comfortable with coming in during those busier times to come in and help us out at night with different tasks and projects. We are enforcing all of our associates wearing masks within the store. We would also like to ask our customers to wear them just out of respect for our associates and other customers that are in the store. Some of our policies that have changed, we're not doing our rental equipment. We have had to change our return policy. Anything that is returned, it's quarantined for a week before it's returned to the shelf. Again, just keeping contact between stuff coming from outside of the store with people that are inside of the store. Our customers are our neighbors, our associates are our family. We want everybody to be safe. We want everybody to come back 100% healthy. So we're doing everything that we can to ensure that both parties are safe.
Well, thank you so much, Trevor. We really are appreciative of the innovative strategies you've employed to try and keep everyone in your shop safe. And we hope that other businesses will be inspired by your example and follow suit. And as mentioned at the outset of this public health emergency, we will be providing updates on not only what the city is doing to navigate COVID-19, but also we will be providing updates on what our residents and businesses are doing to navigate COVID-19. We are all being called upon to innovate and be adaptive and resourceful and compassionate. And fortunately, many of our businesses here in Lincoln are rising to this challenge. They are committed to serving the interests not just of their shareholders, but also of their customers, their suppliers, their employees, and our broader community. And we're thankful for our dedicated business leaders, and we encourage all the businesses here in Lincoln to check the COVID risk dial on a regular basis, to examine the new guidance that has been produced for them, and to contact the health department if they have any questions about how to operate their businesses safely. And with that, we will close up with some good news. Last week, we announced the launch of LNKTPE.com, a website designed to connect residents and businesses that have PPE needs with local suppliers of PPE. And this website was the product of a collaboration between the City of Lincoln and our Lincoln Chamber of Commerce, as we wanted to help local businesses build up their PPE capacity while also giving them an opportunity to support their fellow local businesses. And since the site was launched last Thursday, it has received over 3,400 individualized visits, and there have been over 40 requests by PPE suppliers to include their products on the website. The PPE suppliers listed on the website have received numerous orders from those seeking PPE through the website, and we are thrilled that Lincolnites are taking advantage of this resource, and we encourage businesses to continue to go to this site for their PPE needs. And a big thank you once again to our Chamber of Commerce for updating the website on a daily basis. And with that, we'd like to open it up for questions from the media.
Riley Johnson with the Lincoln Journal-Star with a question for Director Lopez.
She'll be right here, Riley. Thank you.
Thanks, Mayor.
Good afternoon, Riley.
Good afternoon, Pat. I just wanted to double check and forgive me if this was mentioned at the outset. I was having some difficulties on my end, but have there been any updates to the cases identified among the residents of long-term care facilities? I think yesterday you said it was 12 residents total. Is that still the number that you guys know of?
Right. I don't have any new updates today, Riley.
Okay. And another question was, in Omaha, there's been some COVID-19 cases identified among police officers. I think they had 8 of them. Have we had any first responders at LFR, LPD contract coronavirus?
No, we have not.
Thank you.
Pat, this is Diane. I have a question from Brent at Channel 8.
Sure.
We've heard from bowling alleys. They've sent plans to reopen to the health department. Where does the review of those plans stand? And is there an idea of when bowling alleys and other entertainment centers could open up?
You know, we're currently reviewing the plans. I know from the bowling alley and what they're doing, what their proposal is. I think, you know, as we're going forward, we're looking at where we are currently and what other changes might happen. But definitely they still need to be, you know, having an idea how they can follow that 10-person rule or how that can go forward. And we'll share more information as that becomes available.
Director Lopez, Riley at the Journal-Star with another question for you. A reader of ours had asked, does the health department know on a given day how many tests are pending that day, or does the health department's reporting only really include those tests that have come back, that have been notified negative or positive results?
Right, it is the latter. We know when the tests come back to us, how many have been done. We know that just from our contacts with some of our larger testers like Brian and CHI, how many tests they've done a previous day, which is what I report on. But other tests from other labs, we don't know those, the number done. We go by the number of results that we receive back because every testing site, the results come into the health department.
And as of today, with the 8 cases, is there the expectation that there's still more pending tests that the health department will learn about, you know, even today?
Yes.
Thank you.
And sometimes we don't get the test results until later in the day, Riley. It varies. And we just keep adjusting as we need to. And we do monitor that really closely and express any concerns if we feel there's a delay in receiving results.
Are there any other questions from the media? All right, well, thank you so much for tuning in today. Thank you for continuing to try to find out more about how you can protect yourself and your loved ones and your neighbors. We'll be back again tomorrow at 3:30.